Well, the situation has been the same. We are in the 17 days of the GMA strike, and some of the challenges are that our facility, but the beds that we have or the wards that we have now, we are admitting more people than the usual number of beds that we hitherto take. Some of the wards take 24 patients at a time, but now they are taking about 40, and that has made people or patients to lie on the floor. That is the most critical situation now. But with personnel or staff, we had to put some contingency measures in place, like we had to cancel all, suspend all leaves for the period. So all the medical staff who were on leave were asked to come back to help. And on Saturday, we had about 50 or 53, 56 nurses coming in to help us, to help relieve the stress on the permanent staff we have in the military hospital here. And we'll go around and you see that especially the places that we are having the toll is having a toll on us is the maternity and the emergency wards that we have, the trauma emergency and medical emergency, and the maternity. Maternity takes about 50 people, but 50 people normal day, 50 is a 50 bedded, but because of the strike, we can have up to 93 patients, and you see mothers with their newborns lying on the floor. That is our challenge now. Nobody anticipated for the strike to go this long period. So the drugs that we're supposed to have for our normal day-to-day healthcare deliveries, we now have to use more drugs because most of the people are coming here. Over the last week, we had a referral case from somebody coming all the way from Bolgatanga to 37 Military Hospital. And we have other patients coming from all over the country to Military Hospital. I must add that what maybe people do not know is that we have other medical reception stations in all barracks across the country. Even in Accra, we have one at Teshi, that's a military academy and training schools. It's called Peshi, the area. We have one too in Burma camp, and we have doctors and nurses and midwives in all these places. We have one in 2BN, and we have one in 4BN in Kumasi. We have one in 6BN in Tamale and 3BN in Sunyani. So all these medical reception stations too are there to take care of the sick.